You've seen the word peptides everywhere, in weight loss drugs, anti-aging creams, gym forums, and your friend's Instagram. Everyone's talking about them, but here's what nobody tells you. A lot of what you're hearing is incomplete, overhyped, or flat out dangerous. I'm Dr. Zaid Fadul, CEO of Bespoke, Concierge MD. If you're in your 30s, 40s, or 50s and paying closer attention to how you feel, recover, and age, this series is for you. No fluff, no hype, just clear science so you can make smarter decisions. In the next 10 minutes, you'll learn what peptides are, what they already do inside your body, why some are FDA-approved medicines and others are real health risks, and how to organize everything you hear into 4 clear categories. Stay with me through all 4 sections, because the third one could save you or someone you know from a serious mistake. Okay, let's dive in. Let's start with the basics, because this is where most people get lost. Think of peptides like tiny text messages your body sends to different cells and organs. They're short chains of amino acids, the same building blocks that make up proteins, just smaller. Proteins are large, complex structures built from amino acids. When you link a small number of amino acids together, anywhere from 2 to about 50, that's a peptide. When the chain gets much longer and folds into a complex 3D shape, it becomes a protein. So peptides and proteins are made of the same raw material. The difference is size and complexity. But here's a key point. Peptides are not just smaller proteins, they are biological signals. They carry instructions. They bind to receptors on cells and tell them what to do, grow, repair, release a hormone, or calm inflammation. Think of a peptide like a key made for one very specific lock. That makes them different from vitamins and minerals, which mostly support chemical reactions. Peptides actually send messages. They also differ from hormones like testosterone and estrogen, which are built from cholesterol and tend to act more broadly. Peptides are smaller, more targeted, and broken down faster. That's one reason many peptides can't simply be taken as a pill. Your digestive system would break them down before they ever reached your bloodstream. That's why so many are delivered as injections, creams, or nasal sprays. I did a recent video on the Wegovy pill, and it's exactly the issue. You get semaglutide, but when you take it orally, 99% of it is dissolved. That delivery detail matters because it comes back in a big way when we talk about safety. Here's what surprises most people. Your body is already running on peptides right now. 3 examples you've definitely heard of. Number 1 is insulin, one of the most important peptides in medicine. Your pancreas releases it when blood sugar rises after a meal. It tells your cells to pull glucose out of your blood. Without it, blood sugar spirals out of control. That's what we call type 1 diabetes. Insulin was first isolated in 1921 and remains one of the most important medical discoveries in history. Number 2 is a little known drug called GLP-1s. Most of you have heard of Ozempic. That drug mimics a natural peptide that your gut makes called GLP-1. After you eat, GLP-1 helps trigger insulin release, tells your brain you're full, and slows how quickly food leaves your stomach. Semaglutide is engineered to mimic and extend that signal. Tirzepatide goes a step further by targeting both GLP-1 and a second gut hormone called GIP, which is why it tends to produce even greater weight loss in trials. Both are engineered peptides. Both are FDA approved. Both started as nature. Third is growth hormone signaling peptides. Your pituitary gland releases growth hormone, but it responds to peptide signals that help control when and how much gets released. That's the same performance-enhancing compounds like ipamorelin are designed to influence. Bottom line, peptides are not fringe science. They're a basic part of how your body regulates itself every single day. Now, this is where things get complicated, and it's the part most people online skip entirely. This is the most important section of the entire video. Pay close attention, because this is where real harm happens. There are 3 tiers of peptides in today's market. Tier 1, FDA approved. These have been tested in real humans through rigorous clinical trials. They're made to strict purity standards and dispensed through licensed physicians and pharmacies. Insulin, semaglutide, tirzepatide, when prescribed properly, you know what you're getting. This is the gold standard. Next is Tier 2, experimental. These compounds may look promising in animal studies or very early human data, but they don't yet have enough evidence for FDA approval. BPC 157 is the most talked about example. Online, it's marketed like a miracle. Healing tissue, eliminating inflammation, accelerating recovery, but the actual human evidence is extremely limited. I've had several patients respond extremely well to it. That's called anecdotal evidence. The main human study is a small case series with major flaws. No control group, tiny sample size. No robust clinical trials. It was temporarily banned by the World Anti-Doping Agency in 2022, and its legal compounding status is still being debated. That doesn't mean it will never prove useful. It means we don't yet know the right dose, the right patients, or the long-term risks. And Tier 3, gray market and unregulated. This is where the real danger lives. These are compounds bought from unregulated internet vendors and labeled for research use only or not for human consumption. Testing has found wrong ingredients, wrong doses, and sometimes no peptide at all. Some samples even contain lead at levels far above what should ever be in an injectable product. There are now published cases of patients landing in the ER after injecting unregulated peptide cocktails. I have a case I'll describe further in my video on the dark side of peptides. It covers what to look for when buying them. I'll link it above when it's live. The rule is simple. No manufacturer, no batch number, no expiration date, no certificate of analysis from an accredited lab. Treat it as high risk. Let's be honest about something. Because you deserve a straight answer. Peptide science has produced some of the most important medicines in modern history. Insulin has kept millions of people with type 1 diabetes alive for more than a century. GLP-1 drugs like Ozempic have changed obesity treatment and reduced major health risks like heart attack and stroke for many patients. That's not hype. That's what real medical progress looks like. But for every peptide that has earned trust through years of human trials and use, there are many more being marketed online with claims that are just too far ahead of the evidence. Some peptides may eventually prove useful, some may not. I've seen encouraging stories in practice, and my own wife had a very positive response to BPC 157, which definitely got my attention. But anecdotes are not the same thing as rigorous human data. That's the issue. What this field needs and what it's starting to get is stronger federal leadership. The FDA is actively revisiting how peptides are classified, compounded, and regulated. The process is messy right now, but the direction is right. We need real clinical trials and less room for gray market vendors to operate where legitimate medicine should lead. Nobody wants to inject that peptide that was made in some guy's garage and totally contaminated. Now, let's organize a peptide world into 4 clear buckets. This framework will help you make sense of headlines, product claims, and conversations going forward. Medical peptides are FDA-approved drugs used to treat diagnosed conditions like diabetes, obesity, hormone deficiencies, and some infections. GLP-1 agonists are the biggest example right now. This is the most evidence-backed tier, and it's where Bespoke spends most of its clinical focus. Cosmetic peptides are used in skincare. Some stimulate collagen and elastin. Others help deliver trace minerals that support skin repair. Some have decent lab evidence, but broad human clinical trials are still limited. Performance peptides target muscle growth, fat loss, and recovery. Ipamorelin stimulates growth hormone release by binding the ghrelin receptor. CJC 1295 works through a different receptor on the pituitary gland. Many performance peptides are banned in competitive sports, lack long-term safety data, and should never be approached casually. Biohacking peptides are the wild, wild west. Online communities talk about stacking multiple peptides compounds for synergistic effects, but there's no solid clinical evidence supporting those protocols. There is a lot of anecdotal evidence though. I go deep on this in my video on peptide stacking and biohacking culture. Knowing which bucket something falls into is the first step to having a rational, safe conversation, whether that's with your doctor or with us. If you're unsure how to even bring this topic up with your doctor or what to ask them to monitor for you, check out my video, How to Talk to Your Doctor About Peptides. It'll help you walk in prepared. Let's bring it home. Peptides are short amino acids that act as biological signals. Your body already depends on them to survive. The difference between a life-saving medicine and a dangerous gamble comes down to one thing: whether it has been properly tested, properly regulated, and properly sourced. 4 categories, 3 tiers, and 1 principle. Work with a physician who actually understands the space and keeps up with it. Staying on the cutting edge of medicine and helping people optimize their health is exactly why we built Bespoke Concierge MD. We review your labs, your goals, and your full health picture before recommending anything. Whether you're interested in FDA-approved GLP-1 therapy, peptide-based hormonal support, longevity protocols, or just want someone to help you sort the science from the hype, we're set up for exactly this conversation. Our membership plans focus on optimizing health span and lifespan so you can live your best life. Check the link in the description to learn more. Your future self will thank you. And if this video gave you clarity, please share it with someone who's hearing the word peptides and doesn't know where to begin. And drop a comment naming a peptide you would like me to review. I will break down the science and validated benefits of the ones most frequently mentioned. Stick around for the next video in the series. The video on the right reviews how to talk to your doctor about peptides and what to monitor. The playlist on the left covers the peptides and related issues in full detail. And hit subscribe. I publish evidence-based medical content every week that could change your life. See you in the next video.